Good morning, everyone. You're watching Atlanta and Company. I'm Christine Pilara. So happy to be with you today. Right here in Georgia, there's a facility that specializes in helping bring new life into this world. Reproductive Biology Associates was established back in 1983 as Georgia's very first IVF treatment center. Their list of physicians have a combined 170 years of experience in diagnosing and treating infertility. Joining me this morning is Dr. Dorothy Mitchell-Leef, who specializes in reproductive medicine. Welcome to the show.
Thank you, Christine.
Well, thank you so much. This is so important. I feel like so many friends have gone through so much,
yes.
But luckily the flip side of that is there's so many different treatments now that are giving these men and women the families that they've always wanted that they didn't think they could have, right? And that's where your center steps in.
That's right, absolutely. We have a very large amount of technology that's new that we've been able to use over the years to improve our pregnancy rates, especially with in vitro fertilization. We're now freezing eggs. For those women who feel that they may be running out of eggs and they might wish to freeze them for at their age right now and be able to use them in the future. We're putting just one embryo back because our pregnancy rates are so much better, and we're trying very hard not to have patients have twins
with the multiples,
if we can really, and we're really low on that now. So we're much happier about the fact that technology has helped so many patients.
Because just in case anybody is not familiar, typically that's what sometimes happens with IVF, right? You might put in several.
Right.
And then you might end up having triplets. So,
that's right.
So
that's right.
With this, you're actually being able to have a higher success rate with just the one.
Correct.
Right. That's amazing. And let's kind of get a little technical here. Let's start with AMH blood levels, and you kind of touched upon that in a minute. What is it, and how does it impact a woman's decision about timing the pregnancy or freezing her eggs?
Well, anti-Mullerian hormone, or AMH levels, have been around for about 3 or 4 years, and we're using them very frequently now and almost on every patient because it allows us to know about how many eggs they may have left. It's called ovarian reserve. The lowest number, less than 0.16, means you're running out of eggs.
Okay,
If
wow.
it's 4 or higher, obviously you have a lot, so you have more time to think about getting pregnant or not worry. But for those patients whose numbers, which you can get any time of the cycle, you can get it even on birth control pills, so young people should get those. You can get your OBGYN to do it, or any of your physicians could do that for you. But it's very important because that way, if you know that you're low on the number of eggs you have, you could come in and we could allow you to talk about freezing eggs, or if you're trying to get pregnant, don't put it off. At least even if you had to, you could freeze your embryos and come back at another time to get pregnant.
That is fantastic. I mean, it's amazing what technology can do nowadays.
Yes.
And as you said, if you're married, younger, and you're wanting to think, is this something down the road I need to consider? Absolutely get in there, and you make it easy by the fact that it can happen any time of the month. Not at a particular time, which I know
we don't
other
have
tests.
to wait. You don't have to wait like we used to on day 3. So it's now anytime, whether you're on birth control pills or not, and especially if you're just don't have to worry about fasting or anything like that.
Okay, good information. And let's talk about some common myths about fertility care that might need to be clarified. There are a lot of things over the years that have, people that tend to take as the absolute truth and nothing but the truth. So dispel those.
Definitely women are not the only ones who have infertility problems. It happens in 35 to 40% in couples. The men have the problem, not the woman. Wow. Many times it is a combination, so you have to think about that. Many times people say, just wait, relax, and you'll have a baby. I wish that would be true. Otherwise, I would send them all on vacations or be a travel agent myself because that would work better. But unfortunately, that doesn't happen. Many times people think, oh, just let it wait a year and everything will be fine. If you're under 35, make sure you go to see your physician and talk about it after 6 months. I'm sorry, if you're over over 35, under 6 months. And if you're under 35, perhaps even a year. But don't think that that's the only thing that you should do. If you think you have problems like endometriosis or have other issues, you really need to talk to your doctor earlier.
Right. And what is the newest technology that's available for couples that might actually help them, assist them in finding genetic reasons for multiple miscarriages? Because that tends to be an issue.
This is new, and it's actually been around for about 3 or 4 years, but we're using it more and more. It's called complete genetic hybridization, CGH. And we can have embryos that are day 5 or blastocysts, biopsy them, freeze the embryos, and then send them off and have the entire 23 chromosomes evaluated. In the past, we only could do 9. Now we'll know the answer in 10 to 12, up to 14 days. And this way, for patients who might have had miscarriages or have genetic problems that otherwise wasn't elucidated in the past, we actually can get it very quickly and very, very exactly. There's maybe a 5% error rate, but for the most part, you can do all 23 chromosomes. We never could do that in the past.
Right.
And this is really helpful for people with especially pregnancy losses that we couldn't find which embryo was the problem, and we'd put too many back and we'd risk multiples,
Right.
things like that. So now we're just even putting one embryo back in those patients when we've done that testing.
Wow, that is just incredible. And you know, doctor, I think a lot of people, unfortunately, I suffered 2 miscarriages, and I always felt like you feel just so like you're, because we don't really talk about it that much,
Right.
about how common miscarriages can be, and that it doesn't, if you have one, it doesn't mean that anything might go wrong with the second one, but it just, you really, after you have one, it could really just, you know, mentally play
Right.
games with you in terms of your fear, the fear factor, and that's not the case, right?
No, and we have other things we can do. We can do clotting factors, other things. So the CGH is really left for those patients. We have nothing else found that was a problem, and we know more than likely if they had genetic problems in their previous miscarriages
Yeah.
that we should go directly to that.
All right, and last question, treatments that could be used for couples that have that unexplained infertility. They just don't know why. You've tried everything and you can't pinpoint it.
Well, if you had all your tests done, everything was normal, we definitely want to make sure that they are trying at the right time, so we go over that directly. You may need to take clomiphene, which is a very simple medication, just to see if maybe having it all organized and making sure everything is all right. That might work. If that doesn't work, we really worry about egg-sperm interaction, and that it could be that we just need to do IVF to put sperm directly into the egg,
Right.
make sure that we can try and get fertilization, and many times it tends to be that that's actually the problem. But it's otherwise we have no way to know that.
Great information. Thank you so much. It's always
Very
a pleasure having you on.
Thank you.
We appreciate
Thank
your
you.
time. Happy holidays.
Thank you. Same to you.
Thanks.
Thank you.
And if you would like some more information about Reproductive Biology Associates, give them a call. It is 404-257-1900, or log on to their website at rba-online.com. And this segment was paid for by Reproductive Biology Associates.